A very good morning to everyone. This is Dr. Dharmesh from the Department of Oral Medicine to talk about dental age estimation for this month's e-content. So, what is the use of age estimation? So, the main goal is to identify a living or deceased person by presenting a probable age range. That is the goal of this age estimation. Age estimation by dental means is one of the most accepted methods of age estimation. Age estimation is in children is more accurate and straightforward as most methods use the chronological stages of tooth formation, which are highly systematic, reducing the chances of varied results. Contrary to that, tooth formation is already complete in adults, and thus age estimation in adults mainly depends on the post-developmental changes, which can vary highly. So, what are the common methods of age estimation which are followed? The most common ones are visual method, radiographic method, genetic and epigenetic method, biochemical and histological methods. First, we'll look about the visual methods. Remo- This is this is a very crude method which is not very accurate and it's a very old method. The first type is based on the dental attrition. Miles came up with a method to estimate the age by assessing the relative wear of only three permanent molars. He gave 8 grades from A to H, where A stood for slightest wear and H stood for maximum wear. The drawbacks include the teeth wear depends on many factors such as dietary habits, mastication, number of teeth present, restored or prosthetic teeth, malocclusion, and parafunctional habits such as bruxism, making it highly unreliable. So the other method is based on the color of teeth. The color of teeth become darker and more yellowish with aging. This is due to deposition of organic components in the enamel and dentine, which alters the refractive index. Tenkate et al. In 1977 used tooth color as a parameter and established a mean error of less than 10 years. Martin D. et al. Proposed spectroradiometry as an objective method of dentine color measurements of age estimation. Although methods based on visualization are relatively easy and non-invasive, they lack accuracy and precision. So they are not widely used and accepted. Next, we move on to histological methods. This method is based on the regressive changes in the teeth with aging. Some of the most common methods are Gustafson's method, Dallet's method, Johansson method, Maple's method. So the changes that can happen in teeth with age are secondary dentin apposition and cemental changes and changes in the dentinal tubules. Now we'll see how each one is measured. Secondary dentin deposition is thought to be a biological response and an indicator of aging. That is formation of secondary dentin with age increases. Changes in cementum can be estimated by two. It can be cementum opposition and cemental annulations. A linear relationship was discovered between the growth of cementum and chronological age. Si- Similar to the annulations on the bark of a tree, the annulations in the cementum are thought to be an ideal parameter for dental age estimation. Micrometric measurements with scanning electron microscope, we can measure the secondary dentine deposition surrounding the dentinal tubules, that is, the peritubular dentine formation. With age, the dentinal tubule thickness shrinks, and this can be used as a parameter for measurement. Next is Gustafson's method. Gustafson and Thoma describe the age changes occurring in the dental tissues, which include attrition of the incisal or occlusal surfaces, periodontitis, secondary dentine, cementum apposition, root resorption, and transparency of the root. Based on these, they arrived at a formula wherein each value is substituted to arrive at an approximate age. The limitations of this method are that it cannot be used in living individuals and multiple evaluations are needed to be made, which is made it a time consuming process. And PDL assessment is a difficult in decomposed bodies. Next, we move on to radiographic methods of age estimation. Radiographic assessment of age is a simple, non-invasive, and reproducible method that can be employed both on living and dead people. So, this is an advantage of this method. The principle is that the size of the dental pulp cavity reduces as a result of secondary dentin deposition, and the measurement of this reduction could be used as an indicator of age. The radiographic methods can be either prenatal in children and adolescents and in adults based on the age group. The common radiographic methods include pulp tooth dimension ratio, which is the qual, and Camerier techniques, and the tooth coronal pulp cavity index, or known as IKEDA method, and age calculation using X-ray microfocus computed tomographical scanning of teeth. So we'll look into Score and Maslow's method of age estimation. They study the development of deciduous and permanent teeth, describing 21 chronological steps from 4 months to 21 years of age, and published the numerical developmental charts. The disadvantage is that these charts do not have separate surveys for males and females. The next is Nola's method. Nola evaluates the mineralization of permanent dentition in 10 stages. After every tooth is assigned a reading, a total is made of the maxillary and mandibular teeth, and the total is compared with the table given by Nola. The advantages are it can be applied to an individual with or without the third molar, and boys and girls are dealt separately in this method. Next is Moore's Fanning and Hunt method. In this method, the dental development was studied in 14 stages of mineralization for developing single and multi-rooted teeth. Permanent teeth and mean age for the corresponding stage was determined. The earliest age in the survey was 6 months. The data also include the development of the mandibular third molar. Next is Demirjan, Goldstein, and Tanner's method. In this method, 7 mandibular permanent teeth were rated in the order of second molar to central incisor and determined 8 stages of tooth mineralization. The stages are the indicators of dental maturity of each tooth. In this method, each missing teeth from one side can be replaced by those from the other side. For example, if the first molar is absent, the central incisor can be substituted for it as their developmental age coincides. The drawback of this method is the survey does not include the developing third molar, and the mandibular teeth need to be present for the survey to be applicable. The next is Camerier method. In this method, 7 left permanent mandibular teeth were evaluated, and the number of teeth with root development completed with apical ends completely closed was calculated. For the teeth with incomplete root development, that is with open apices, the distance between the inner sides of the open apex was measured. For the teeth with 2 roots, the sum of the distances between the open apices was evaluated. To nullify magnification, the measurement of open apex or apices was divided by the tooth length for each tooth, and these normalized measurements of 7 teeth were used for age estimation. Next, we move on to age estimation in adults. Clinically, the development of permanent dentition completes with the eruption of the third molar at the age of 17 to 21 years, after which the radiographic age estimation becomes difficult. Two methods commonly followed are the assessment of volume of teeth and the development of third molar. Based on the volume of teeth, we have the qual pulp to tooth ratio method and the coronal pulp cavity index. Based on development of third molar, we have Harris and Notcase method and Van Heerden system. So, in Qual's method, the pulp to tooth ratio was calculated for 6 mandibular and maxillary teeth using IOPS, and it was substituted in a formula to determine the age. In the coronal pulp cavity index, only the mandibular premolars and molars are considered, as the mandibular teeth are more visible than the maxillary ones. Panoramic radiography is used to measure the length of the tooth crown and length of the coronal pulp, and it's substituted in a formula to determine the age. So next is Harris and Notcase method, which is based on the development of third molar. They are given 5 stages of third molar root development with corresponding mean ages and mean length. So based on the third molar's root development, we are correlating the age of the patient based on the chart given by Harris and Notkin. Next, we have Van Heerden system. Van Heerden assessed the development of mesial root of the third molar to determine the age. He described the development of mesial root in 5 stages using panoramic radiographs. Next, we have ventral foramen and mandibular canal measurements with which age has been determined in recent years. Bharatwaj et al. In 2014 used panoramic radiographs for assessing gonial angle, antigonial angle, ventral foramen, mandibular canal, and mandibular foramen for age estimation and found mandibular canal and mandibular foramen as a very significant parameter correlating with the age of the patient. Recently, technological advances have made the application of AI possible in the forensic world. One such study by Kim et al. In 2021 considered only first molars from OPGs. They obtained accuracy of 89 to 90%, indicating excellent outcomes. The parameters that were focused include tooth pulp, alveolar bone level, interdental space depending on age and location of the tooth. Next, we move on to the biochemical methods. In the natural aging process, several molecular changes occur most commonly in the long living proteins and hard tissues like teeth and bone. Aspartic acid racemization, collagen cross-links, lead accumulation, advanced glycation end products, enamel uptake of radioactive carbon, microdontial DNA mutations are some of the most common changes that can be used to track the age of the patient. Among these methods, racemization of aspartic acid can be considered the most precise method. The advantage include the sample can be collected from the tissues, protected from various environmental and nutritional factors. If all the confounding factors are stable, the utilization of advanced glycation end products can also be considered valuable. Next is genetic and epigenetic methods. Telomeres at the end of the chromosomes shorten with each cell division, limiting the proliferation of human cells and inducing senescence, differentiation, or cell death. Telomere shortening may be an effective method to estimate age. Takasaki et al. In 2003 determined the terminal restriction fragment length as telomere length in dental pulp DNA and determined the age. The limitations of this method is, as expected, it's going to be really expensive and technique sensitive, and it can yield variable results which are not reliable. So these are my references. Thank you for your listening.